A coalition of Black and Latino leaders in healthcare and businesses have filed legislation to combat racial and ethnic health disparities in Massachusetts. Dr. Joe Betancourt, an expert in health disparities, is part of this coalition, and he just became the first Latino to head the Commonwealth Fund, an organization that seeks to eliminate racial and economic disparities in healthcare. Dr. Joe Betancourt, thank you so much for joining us this evening.
Thank you so much for having me.
Yeah, so we've been talking about health disparities for more than 2 decades. I remember back in 2002, the National Academy of Medicine released the Unequal Treatment Report, and you were actually part of a group of physicians that worked on that report. Can you tell us a little bit about what that report, told us at that time about health disparities?
Yeah, thank you, and appreciate this conversation. It's a very important one, and it's not a new one. I think that's what's really interesting and I think important today as we consider the future here in Massachusetts. So, disparities in health are simply differences in the health outcomes that people have, and they happen for a variety of different reasons. We see that vulnerable communities, particularly those who are poor, people of color, those with disabilities, tend to do less well than their majority counterparts. Mm-hmm. And we know that these disparities, particularly racial and ethnic disparities, are longstanding. They've been part of our national fabric for hundreds of years since our creation. And we've been at the process of trying to better identify and address these differences. And we know these differences are due to things like the social drivers of health, your ability to get food, exercise, your ability to have gainful employment. We know it's due to issues like access to care. And we know that there's differences in quality of care as well. So these things in combination lead to these disparities where minority populations tend to have poor health outcomes from some of our nation's largest killers like cardiovascular disease or diabetes. So
we have some data from the Massachusetts Health Insurance Survey. We're going to have it on screen soon. So you can notice that 18%, more than 18% of Hispanics in Massachusetts, they do not have a usual source of care compared to 8% of white people and 9% of Black. Why do you think, as an expert in health disparities, why do you think this is happening?
Yeah, well, I'm a primary care doctor. I'm originally from Puerto Rico. I'm Spanish speaking. A lot of my patients are Latino. And so I'd say a couple of things. We're very fortunate in our state that we have a very, very low rate of individuals who are uninsured because we've been very progressive, very thoughtful around health insurance. But at the end of the day, we still know that there are many individuals, and particularly Black and Latinos, who fall through the cracks. Even when eligible for insurance, they may not have it. And they may work in jobs that may not provide employer-based health insurance. So at the end of the day, we do see that Blacks and Hispanics are 2 times more likely to be uninsured here in Massachusetts. Now, this is compounded by the fact that even if you have access to care and insurance, as you demonstrated with your data, that you don't have a usual source of care, someone who you identify as your doctor. And we know that is critically important. Those who have a usual source of care, who are linked to a primary care provider, research tells us have better health outcomes. And so what we see there, particularly for the Latino population, is we know that many of our Latino patients across the state may not have a doctor who speaks their language, may not have a healthcare provider who understands them. They may work 2 jobs where accessing healthcare then requires them to maybe go to different spots on an as-needed basis. So it's that set of issues that the Health Equity Compact and this new legislation is going to aim to tackle, among many, many others. But clearly having a usual source of care is very, very important.
Is immigration status also a barrier for many people, many immigrants here in Massachusetts to access health care?
It is, and I think ultimately we also as a state have been very progressive and thoughtful around this. The Health Equity Compact, which was assembled now in May, 55 leaders of color who really ultimately are trying to maintain our position of leadership, Massachusetts' position of leadership in the nation, to assure that we provide high quality care for anyone, no matter who they are or where they're from. And I think, yes, immigration status can play a role for people where they may not seek care because they're concerned about their immigration status. Now, I'd say this is particularly important coming out of a pandemic where we realize that something like a virus, COVID-19, doesn't pick who it's going to infect, whether it's the individual's a citizen or not. And we all are a community and come together as a community. So this idea of making sure that we care for everyone in the midst of our community in a thoughtful, practical, common sense way is what we're trying to accomplish. And I think addressing immigration status and insurance status in that regard is going to be very important.
Dr. Betancourt, so you are also part of this coalition that's presenting this bill in the legislature, the state legislature. Can you tell us more about this bill and what it's trying to accomplish?
Certainly. We've had the good fortune in our state of being really proactive, I believe, in the area of disparities. There's been, going back to the early 2000s, work at the state and city level under Mayor Menino, work that's progressed under different leadership, both, again, at the state and the city level. And so what we're doing is taking this next step, coming out of the pandemic, having better data around quality, access, coverage, really saying, how can we, as a health equity compact, a group of, again, 55 leaders from multiple industries within healthcare who've been working hard to think about the legislative fixes and approaches that we can engage in to address these equity issues. And so there's a variety of them. And one of them really is centering this concept of equity at the executive level. So creating a cabinet level executive office of equity, doing more on data collection as a state level to make sure that our health outcomes are not inequitable and fixing them when we find them. Really thinking about ways in which we can, as we've discussed here, think about coverage beyond immigration status, better powering our provider organizations to care for diverse populations, really thinking about cost of medications for chronic diseases that disproportionately impact communities of color, and then focusing on the social drivers, things like issues related to employment, housing, food insecurity. I'd like to end by saying that everything we are aiming to do will not just address disparities and eliminate inequities, but it will improve care for everyone across the state, because a lot of these challenges are faced by different people, not just people of color.
Do you feel confident that this bill will gain enough support to hopefully pass in the future?
I think we're excited about this. This is the right time. We have an administration that is really, I think, focusing on equity. We have, key leaders across the state coming together like never before from different industries. We have a brand new slate of legislators who are of diverse backgrounds, Black and Latino legislators. This is the tipping point, and I think this is our chance to lead yet again on health and healthcare in the United States.
Dr. Betancourt, do we have enough doctors and nurses and health specialists in general from communities of color?
This issue has become particularly acute after the pandemic. We have incredible shortages in the healthcare workforce that are really impacting our capacity. It's making emergency department wait times exceedingly long. Our hospitals are bursting at the seams. When we think about issues related to diversity in the healthcare workforce, this is, again, something that we've been working on for decades. We know that minorities, about 30% of the population, only about 7 to 8% of physicians are physicians of color. And certainly we see the same among nurses, mental health workers. So what we are simply saying is, yes, we need to be more deliberate in building that pipeline, creating more diversity among our doctors, nurses, frontline staff. And I think that will address that usual source of care data point that you provided, because patients can feel more comfortable engaging with a provider who might understand them, speak their language, and better engage them. And so this is a long journey. We've made progress over the years, but the answer is absolutely not. We do not have enough diversity in the healthcare workforce. And the solution is get to work. And I think this our Health Equity Compact and this legislation will aim to support that as well.
Great. Dr. Betancourt, thank you so much for being with us this evening.
Thank you.